Urbanization is one of the leading global trends of the 21st century that has a significant impact on health. By 2050, more than 70% of the world population is expected to live in urban areas.
By 2050, more than 70% of the world's population will live in cities. The fastest urban growth will occur in low and middle-income countries.
WHO's Southeast Asia countries are home to about 750 million population with an average of 34.3% of the total population. Although the growth rates of urban population in Southeast Asia countries are varied. The highest growth rates are seen in Bhutan and Maldives, followed by Timor-Leste, Bangladesh, Thailand, Nepal, Indonesia, India, and less growth areas in Sri Lanka and DPR Korea. By 2030, 105 cities in Southeast Asia will have more than 1 million population. 36 cities more than current number and 10 cities will be mega cities that have more than 10 million population. Such massive rate of growth of population and proliferating cities presents us with urban health challenges. That is tremendous health burden of infectious and non-communicable diseases. This is why the need to improve on social determinants of health that relate to an individual's place in society, income, education, employment, environmental surroundings is more than ever before today.
If you want to stay healthy, we have to look at what's the environment we live in, work in, play in. So we start to think about housing, education, the workplace, parks, transportation, water and sanitation, social services. These are all different factors that really contribute to good health. So this is what we often call the social determinants of health.
WHO's Southeast Asia Region offers healthy city initiatives that can contribute to improve infrastructure and enabling conditions for health and well-being of nearly 750,000 population brings together various stakeholders such as World Health Organization, Swiss Agency for Development and Cooperation, United Nations organizations, public health institutes, governance structures, municipalities and NGOs to support the Sustainable Development Goals.
Urban governance is really a system of how the key stakeholders work together. Of course, we expect the city government to be in the lead, but city governments have to coordinate with so many different groups because there's private sector, there are people in the community, there are so many social institutions, and people have different needs. So governance is really about bringing all the actors together with the government in the lead.
One concrete action on this front is the Urban Governance for Health and Well-being project. In 2019, WHO and the Swiss Development Corporation agreed on a joint initiative on urban governance for health and well-being through civic engagement. The main goal of this initiative is to improve the health status and well-being of the populations using participatory and multi-sectoral urban governance towards the cause of healthy cities.
Out of that agenda are these 17 Sustainable Development Goals, or SDGs, as we typically call it, covering every facet of life.
Health is an input and outcome of development. The governments are faced with urban health challenges of responding to the scale of growth and recognize that improving the social and environmental conditions, including equitable access of quality social services to its population, is a good start in the direction. While governments play important roles in ensuring no one is left behind, Communities and civil society group capacity should be strengthened to support the most vulnerable persons. The recent COVID-19 pandemic has seen vast devastation in across countries and societies with little or no preparedness to combat the disease. The impact has been so grave that many families and individuals have been pushed much below the poverty line and are facing acute hardships due to multiple adverse effects because of the pandemic, while many lost livelihoods and left to grieve the unexpected demise of near and dear ones. This endorses the need to improve health equity in rapidly urbanizing cities and strengthen healthy city networks to be responsive to equity and governance. This role, however, is limited not only to governance but also communities and civil society at large. It is thus critical that cities can respond to current health and well-being needs of their populations and have the capacity to prepare and respond to emerging health crises.
Now we are in the preparation for implementing the new normal. Economic and social activities can be carried out with strict health protocols such as wearing masks, keeping a distance, and washing hands.
While city governments and mayors' roles and responsibilities vary according to the national framework for the public administration.
All cities are on the front line for managing diverse aspects of human sentiments.
Be it housing, road, transportation, sewage,
recreational space, social services, or environmental protection.
Urban governance does play an important role on how city government plan become environment for securing health and well-being.
Health equity for all residents.
Local governments are therefore
Constantly on the lookout for best practices.
Let us look at some of the core features and guiding statements for urban governance for health and well-being. Mayor's leadership, multi-sectoral collaboration, community engagement, equity and social inclusion.
The leadership of mayors has a profound effect on the health and well-being of their citizens.
At the same time, there may not be a definitive blueprint when it comes to revising strategies for urban governance for health and well-being, as the response may require to be tailor-made to geographical, demographical, and socio-economic dynamics of the region.
So by reflecting the views of people in the way that policies are formulated and thinking about tailoring the policies to different communities, we can work together with both a top-down and a bottom-up approach that create a good, healthy urban environment.
This brings diversity in ways to address the health challenges. It is interesting to note the various ways different Southeast Asian countries have worked towards health promotion and in building healthier cities. Over the past few decades, the region has seen rapid economic growth in most countries, and this growth has improved the living conditions of large sections of the urban population. It has led to the emergence of an urban middle class with an increasing demand for more efficiently functioning cities and towns, an increasing capacity and willingness to pay for good quality public services. In order to meet the needs of the urban population, many national governments in Southeast Asia have adopted policies of decentralization and public-private partnerships on top of the promotion of economic globalization. In theory, decentralization and multi-sectoral partnerships improve urban governance as decision-making is closer to the population. Another crucial aspect of urban governance for health and well-being is planning for healthy cities and provisioning for health promotion activities for the citizens. A healthy city has physical and social environments, community resources that enable people to live a quality life marked by physical, mental, and social well-being, which is the core of healthy city, because healthy city creates healthier societies. For social cohesion, peace, safe space for everyone, clean, green and accessible for social activities.
Think about health and well-being. We are talking about everybody being able to achieve the best possible health, whether that's physical, social, mental, or spiritual.
Thai Health, in collaboration with the Chula Unisearch Chulalongkorn University, has worked on development of healthy spaces such as Healthy Space and Learning Garden in the community around Siam University, and TU Outdoor Activities Space within Thammasat University Rangsit Center. Exercise activities are initiatives on the lines of community's context, so that people can continue to increase physical activity levels and get better health. These public health areas and outdoor equipments are used by people from all groups: children, adolescents, adults, and the elderly from different occupational backgrounds who live or work nearby. Most of them are in need of the large public exercise space due to the limited personal living space. This innovative project was successful with participation in policy measures, planning and mission governance, not only by national, state and local governments, but also other health partners and members of the community. City's leadership structure should have a single authority under a city mayor who is empowered to take cross-sectoral decisions, including decisions related to urban planning, transportation systems, purchasing, supply of energy, water and sanitation, and waste management. Strategic urban planning will be the key to creating supportive and enabling environments for health, making sure that health and equity considerations are integrated throughout the planning process, investments, and policy decisions at the local level.
However, unplanned and rapid urbanization can exacerbate social disparities and inequities in accessing health services and expose people to environmental risks. Mayors are at the forefront of these challenges. Global networks of city leaders such as these are a powerful tool for exchanging ideas and lessons learned as we all work to keep populations safe and healthy.
While cities can bring many challenges, they can also bring opportunities for better health, cleaner environment, and environmental action. Supportive and enabling policies on health from the highest levels of decision makers are essential for fostering good urban livelihoods, building a productive workforce, creating resilient and vibrant communities, enabling mobility, promoting social interaction, and protecting vulnerable populations. Sustainable development cannot be achieved without significantly transforming the way we build and manage our urban spaces. Responding to changing urban landscape and health challenges is the need of the hour that requires whole of government and whole of society approach. Good urban governance implies that all citizens, including the poor and other marginalized groups, truly have the rights to participate directly or indirectly in decision-making that affects their life and livelihood.